Hello, I'm very pleased to join you and just say a few words about the work of WHO on the COVID-19 response in Africa. At WHO, we are working day and night to save lives and stop the spread of this virus. Every morning, we analyze how case numbers are changing in order to provide strategic and timely advice to governments and to our partners. And every day, I am encouraged by the bright spots. For instance, Namibia and Seychelles have implemented WHO recommendations closely and have now gone almost 3 weeks without reporting a confirmed case. We've seen other countries like Mauritania mobilize thousands of healthcare workers in order to contain the spread at the local level. I encourage countries and partners to accelerate and sustain the public health response in the coming months. This means good surveillance, identifying cases, testing them, isolating them, caring for them, tracing their contacts, and isolating those too. We also need to fully engage and empower communities to protect themselves and others and to strengthen health systems to ensure continuity of provision of other essential health services. And as far as communities are concerned, I've just finished a launch with some partners on a report of a study that we carried out in over 20 countries to understand how communities are experiencing this outbreak and also what they know and understand about the outbreak and the impact on some of the mitigation measures that have been put in place by governments. We learned, for example, that through risk communication carried out by governments with support from WHO and partners like UNICEF, many people are informed. They know about the COVID-19. They know that it's a risk for their countries. We've also learned that we need to do more work for them to understand the risk to themselves, to their families, and very importantly, that some of the measures have such an impact on people's lives, especially vulnerable households, that governments and partners need to put in place mitigation measures to support people to be able to comply with the prevention interventions. To defeat COVID-19, we need to sustain international solidarity and to advance research and development of vaccines and treatments, and we should ensure that everyone, particularly vulnerable communities like low-income households and refugees, can access the care they need. We will keep working with partners to make this happen, and in this connection, I'd like to sincerely thank the Hilton Foundation for your partnership and support to WHO.